Hi, I'm Dr. Anthony Cave, a Harvard and Stanford trained, board-certified anesthesiologist and integrative medicine specialist. And I call my patients the night before their surgeries. Why? Because this is the most mysterious room in medicine and possibly the world. When patients come in this room, you literally wipe their memories. You have your clothes taken off, you get funny medicines like this, you have to put a mask over your face just to breathe, and patients think that they're totally helpless in this whole experience. That couldn't be farther from the truth. My patients rarely know that surgery and anesthesia can not only be one of the most vulnerable experiences in their lives, but also one of the most powerful experiences to tap into their inner healing potential. That's because anesthesia can help uncover one of medicine's greatest secrets, the ability to heal yourself. And we're talking anxiety, depression, PTSD, addiction, phobias, cardiovascular disease, and so much more. If you've seen my past videos, you know there are different flavors of anesthesia. There's light anesthesia for things like colonoscopies and endoscopies, and then there's deeper anesthesia, what we call general anesthesia, for more major surgeries. Both can be powerful for you to gain more insights about yourself. It's because we think of anesthesia as turning off our brains, which is true, but it also turns off parts of our brains that inhibit us from reaching our full potentials. And that's the part that can interfere with us learning how we can heal ourselves, what we call the inner healing potential. When your inhibitions get turned off in the operating room with the medications that we give you for anesthesia, it's different than just getting drunk off of alcohol. There's three major things going on when you're having surgery. It involves the major life disruptor for which you're having surgery for. You have a guide, like your anesthesiologist, who's trained in how to guide you through the depths of anesthesia, literally that medical coma that you're going to be in for your surgery. And third, we use medications that can often give you insights into yourself to help you discover your inner healing potential. This whole experience is very different than drugs of abuse that people use on the streets. But we can't get to this deep level of healing if we haven't first connected before your surgery. And that's the first reason why I call my patients the night before, to learn about their medical histories and to talk about the anesthesia plan that I'm tailoring to their specific personal and medical history. We talk about the breathing tube, the risks and benefits of nerve blocks, spinals, epidurals, and all the basic anesthesia things that go into you safely having your surgery done. But that's only the start. That's the door to learn more about my patients' past histories: anxiety, depression, addictions, whether it be alcohol, smoking, chronic marijuana use, food, chronic pain, past traumas, and so much more. And with the right patient, we can use the surgery and anesthesia experience to heal the mind as much as the body. And with that healed mind, we can then begin to tap into the inner healing potential that will serve my patients not only for the surgery and recovery, but even after the operating room for months, years, or even a lifetime. Not to quote Spider-Man or anything, but with great vulnerability comes a great healing potential as well. It can literally open you up to new insights about your body, like how I've shown you on my own body. If you saw my other video when I actually induced a panic attack in myself connected to a ventilator and monitors, you saw how I put myself into a panic attack and how I snapped myself out of it. And that was without any medications at all. That's all by tapping into the mind-body connection and the inner healing potential. And that's one reason why clinical hypnosis was so powerful, especially for surgery, before the application of ether to induce general anesthesia. For better or worse, when we discovered how powerful ether and modern-day anesthetics can be for surgery, we kind of abandoned a lot of the original clinical hypnosis principles. It's actually making a renaissance nowadays, though, because we know there are some populations that are more vulnerable to the risks of anesthesia. I personally use clinical hypnosis for young children in the pediatric population, for the elderly, and for those patients who have addiction disorders. Because for these patients, the risks of anesthesia medications might be more than the benefits. In children, there's concern for anesthesia affecting the developing mind. In the elderly population, there's concern for post-operative cognitive deficits, like grandma or grandpa not quite being the same after their hip fracture surgery. And in patients with a history of addiction problems, I don't want to give them the same medications that they've been able to be sober off of for months or years at a time. And even for patients that don't fall into those categories, using less anesthesia, because we've integrated clinical hypnosis into their surgery experience, means that they're likely to have fewer side effects from the anesthesia, things like nausea or even worse pain. There's typically 10 to 20% of my patients who think this is hippy-dippy, new age kind of stuff. That's simply not true. By having the right mindset before your surgery, which is what I discuss with my patients the night before their surgeries, you lower your chances of many complications from surgery surgery or anesthesia, not only is it that getting less anesthesia means fewer side effects like nausea, but also a lower chance of certain surgical complications like blood clots or poor wound healing, or worse pain. And with the right patient, we can dig even deeper and actually find the source of so much of deep-seated suffering and find the inhibitions to them tapping into their inner healing potentials. It's like retraining the brain, and it's possible in part by the mindset that my patients bring in when they're prepared for their surgery, when we've met before, so they can trust me as their guide through the surgical experience, and partly from the anesthesia itself that literally removes your inhibitions, like taking the shades off of your insight into yourself, what ordinarily might veil your brain, mind, or heart from being able to discover how it can heal itself. And this is all possible when my patients know that they're cared for, loved, and guided in the most frightening experience of their life. Here in the operating room, when they're in their most vulnerable state, unconscious, under anesthesia. Some patients can completely break addictions like those that quit smoking cold turkey after anesthesia. And many patients can learn how they can overcome their anxiety and depression and lower their medication requirements or possibly get off of them altogether. And with patients that are ready to start that journey, it begins with that phone call the night before their surgery. If you or someone you know is having surgery sometime soon, leave a comment below and let me know. I'd be happy to give my insights on how you can make the most out of your surgery and anesthesia experience. And remember that you have more control over your health than you've probably ever been told.